World Mental Health Day. So we've had a look at the mind, the components of the mind, and we've had a look at the things that can affect the mind. So the mind is made up of the intellect, the will, and the emotions. It's not some vague thing over which we have no control. We can address those factors. And the factors that affect the mind are psychological, social, and biological. We've had a look at how those things can be addressed. Now let's have a look at specific approaches and interventions. Again, we're going to follow that biological, psychological, and social approach. So, first of all, with biological factors, we can address physical illness. We can address medication factors that may be impacting on mental health. I mean medication for physical illness this time. So those are areas that can be looked at to optimize mental health. For example, anemia can be treated. That will deal with the lethargy, that will deal with the lack of motivation. Similarly, a low thyroid function, or where people are chronically ill physically, that can be looked into, the right treatment and support given. So that's briefly looking at biological factors. Now, when it comes to social factors, there's a whole lot that can be done by non-professionals. There's a whole lot that can be done by you and I to help the people that we care about with regard to their mental health. The first thing that can be done, which is, it can be difficult, but it's reasonably straightforward, is just speaking. It's giving a phone call. It's sitting down and having a chat. It's asking, how are you? What's going on? What can I do to help? Sometimes all people need is a listening ear, at least in the beginning, to get things going. So social factors, it's giving support, it's giving encouragement. It's looking at offering practical help with day-to-day tasks. It's looking at a person's finances and their accommodation and their employment, and looking at how to improve things in that area. And the third area where intervention can be given is psychological. It can be given by both professionals and non-professionals. With non-professionals, we're looking more at having a chat, at counseling, advice, encouragement. Professionals, we're looking at psychological interventions, and there are various therapies. One more thing with regard to biological approaches is medication treatment for mental illness. That's usually required if symptoms are moderate to severe. So there's a whole range of things we can do. I usually say this: if in doubt, give a shout. If there's any concern whatsoever as to whether professional help is required, give a shout, seek professional help. There are lots of approaches, and there's a whole lot that can be done to help us have good mental health. World Mental Health Day. Let's talk about it.